Hey everyone, welcome back to The Happy Flosser, the podcast that keeps you grounded, supported, and growing through every single stage of dental hygiene school and beyond. I am so glad that you're here today with me because we are going to talk about something that affects every single student, every single clinician, every it actually affects every profession too. It's ergonomics, posture, and staying healthy. This can be incredibly challenging. We tend to lose our focus when we are working on our patients, so it's important that we have this conversation while you are in school and you can develop and learn these really good habits that are essential for long-term career. If you've ever ended a clinic session feeling like your neck is made of concrete, or your lower back is screaming, or you have a migraine, or your shoulders are trying to live somewhere up near your ears, this is the episode for you. And you're not doing anything wrong, guys. You are learning a brand new profession that is asking a lot from your body. So today we're going to talk about how to protect your body, how to build really healthy habits early on, and how to stay well while you're becoming the clinician that you are meant to be. So let's start with the truth. Dental hygiene is physically demanding. And I think people outside of the profession would be surprised to hear that. You are literally working in this small space with tiny, tiny instruments on patients who don't always position themselves the way that you wish they would, right? And then you're doing all of this while trying to remember your sequence, your time management, all of the steps involved, the faculty feedback that was at your last clinic session that keeps ringing in your ears, and then your patient's medical concerns, medical histories, and then adapting to maybe your patient's dental anxiety. So of course your body feels it. Whose body wouldn't feel all of those things? But here's the empowering part, guys. The habits that you build now will follow you into your career. And the earlier you learn to protect your body, the longer and healthier your career will be. Ergonomics, it is literally the center and the core of everything after that. It's one of the first things that your faculty talk about. And I know any of the students that have worked with me in clinic, I always stop by and say, shoulders back, neck straight, all the things, chin back. You guys tend to have your chin tilted forward, chicken wing, and I want students to know it's because I want you to have a long career. You're investing a lot of time to develop these skills. So it is the core of what we should be thinking about. When I just had a student on TikTok who asked me about sextant to lingual and how to do sextant to lingual, and it's about having the patient in the right position with their chin up. It's also about having you be very skilled with your indirect vision, because sextant to lingual is just hard all the way around, and unless you learn the skill of your indirect vision and proper management of your patient of having their chin up, it's going to be hard for you to have good ergonomics in that area. So we'll just use that as an example. This isn't about perfection, guys. Sometimes with patients who have to have those alternative treatment modifications, it's going to be impossible to have good ergonomics. They can't put the chair back all the way. They have medically compromised issues, those types of things. It's so you can't be perfect all the time, but it's about being aware. It's about noticing when your shoulders creep up, or when you're leaning too far forward, or when your fulcrum is doing more work than your core, right? It's about catching yourself with kindness and making that adjustment. That's what it's all about. So here's what I'll say. One of the things that's been incredibly helpful for me is having the other providers in the office help me manage myself, because you can say that you're going to watch your posture and all of these things, but unless you have like a team effort where someone's like, oh, yeah, you were leaning way forward. I bet your shoulders are bothering you. Hey, your shoulders are getting closer to your ears. It's lunchtime. So that you can kind of hold each other accountable in a supportive and really encouraging way. So let's talk about the posture traps that almost every student falls into and really how to gently correct them. So that forward head lean, because we just need to take a peek, right? That moment when you're trying to see just a little bit better, and suddenly your chin is literally in the patient's lap. Like you're just literally leaning so far forward. Even with ergo loops, I'm seeing students do this because of that indirect vision skill development. That skill acquisition maybe not be completely developed. And sometimes it's just easier for us to just try to peek, right? So you want to bring the patient to you, not the other way around. Raise or lower their chair. Use that indirect vision, even when it feels awkward, because it's going to go a long way in helping you. The next little thing that I see students do is the little twist. So you'll have that twisted torso, and you guys all know this one. Your upper body is rotated and your lower body's facing in another direction, and your spine is like, if your spine had a voice, it would be saying, "What are you doing?" Right? So the correction for this is to really reposition the patient's head and turn it like a clock. You are allowed to move your patient. Oftentimes we move ourselves and our patient stays in this neutral position. Ergonomics is impossible if we don't find ways to manage the movement of our patient's head, either toward us, away from us, chin up or chin down. It makes all the difference, guys. This is a deal maker or breaker. And then the other thing I see students do, and I am not calling out any specific students, so it's not like just my students at my school are the only ones doing this. I see this in TikTok videos and Instagram videos all the time too. So the perching on the edge of the stool. So when you're half seated and half floating, you are literally fully uncomfortable or putting way too much pressure on your core, on your hips, right? So you want to engage your core gently. Let the stool do the work and support you. So sit all the way back in that chair. That's going to give your lower back support. That's going to support your hips and your knees and ankles. Like these types of supports go all the way to the base, guys. So it's just crazy. These are the things that we do. So the shoulder shrug of doom is the other piece. So when your shoulders slowly rise as the appointment goes on, and then they're almost touching the bottom of your ear, that is so taxing on your upper shoulders, your neck. It really causes all kinds of musculoskeletal issues over time. And I think it's one of the hardest things for us to recognize is the shoulder issue. So just kind of pause, exhale, drop your shoulders back. And what I do is I do a mental reset between quadrants. So if I'm working on the upper right sextant one, and then everyone has different, ways that they go about each of the quadrants in their mouth. And for you guys as students, depending on what clinic you're in, this is going to dictate that. But see if you can find a space that you can actually call that your shoulder check space. Like if you are working on the maxilla and you move to the mandible, check your shoulders, like resetting your shoulders. Or if you go from one quadrant to the next, actually taking a pause to like reset your shoulders during the appointment sequence goes a long way. The other thing that I always did, I did isometrics where I would hold my stomach in while I polished because that kept my core strong. Because I guess if you hold your stomach in for a certain amount of time, it's like doing a sit up. And I know that a strong set of abs makes a strong lower back. So every time I would start polishing, I would do isometrics. So that would be really long isometrics in school when you're learning how to polish, but you guys get the idea of what I'm saying. So find little spots during your appointment to actually make it work, where you're actually working your body to strengthen and develop that posture. And then the other piece, guys, you guys all do this, and I do this too. Everything I'm telling you that I see you do, I also do. So I'll just make it work position, right? And you know that. You know that position when you know the ergonomics are out the window. Maybe on one of your community rotations, you're like, I just have to be efficient here. I just have to be faster. So your ergonomics go completely out the window. And I get that. I really do. I've been behind. And when we're behind, we kind of throw out all of the tactics that we use as well. So when you know it's not ergonomic, but you're still trying to be efficient, you have to remember that efficiency actually comes from good ergonomics, not from rushing through discomfort. So it's really important for you to really be mindful of that because you don't want to end up hurting yourself and then you're having discomfort and that's going to slow you down. So if you're looking for efficiency, part of efficiency is good posture. All right. And you don't need, I, I would just say also, you don't need to have like six pack abs either to have like a strong core. Um, you don't need a full workout routine in clinic. You need micro habits that really support your body all day long. I used to work in this office where there was this long hallway and all of the operatories were on the left and right sides of the hallway. So every time I was going to get the doctor for a doctor exam, I would do lunges down the hallway. It was good because it helped me stretch, and I didn't even realize it was helping me stretch because you're in a seated position. This is literally just like one little thing that I would do. Between every time I would put an instrument down, I would stretch out my fingers right before I pick up the next instrument. Sometimes just doing these little tiny micro habits all day long really keep your body happy. So like you could do like a 10-second reset. So between each step, roll your shoulders back, unclench your jaw, and breathe. If you're going to ask for a doctor exam or you're waiting for the doctor for one reason or another. The other thing you can do is like a foot placement check. Like what are your feet doing? Are they up on the legs of the stool or do you have them firmly planted on the ground to stabilize your core and protect your lower back? The other thing you can do sometimes once we start doing a working stroke, it's really hard to undo a working stroke and do that light grasp. So lighten up your grip a little bit. Your hands really appreciate if you take the time between those working strokes to do light and fluffy when you're just doing assessment or you're just doing light debridement. You don't have to be fully gripped onto that instrument all the time. Right. Moving that patient instead of you is going to go a long way. So kind of double check yourself to say, when was the last time I told my patient, turn towards me, please, or chin down, please? Like think about your command of that appointment. Are you letting the patient, that neutral position of the patient, dictate how your spine feels by the end of the day? And I will tell you guys, headaches are the best indicator of your level of ability to manage the patient. If you are leaving clinic with a headache, the tension is coming from your neck, you're clenching, all of those muscles and mastication being overly worked because you're concentrating so much on things. So the other thing I will tell you as a hack is while you're washing your hands, stretch your wrist, right? Bend your fingers back to stretch your wrist when you go to wash your hands, because that is going to really help you as far as like, think about how many times you wash your hands. If you're doing these little micro habits all day long, they add up little by little. These things happen. And these tiny resets are essential because I don't want you feeling like you've aged 40 years after one day of clinic. We need your body to be strong, right? So, strengthening your body, not going to the gym every day, but supporting your future career, right? Because we know that dental hygiene requires really stable core, right? Upper back strength, wrist mobility, hip flexibility, and endurance. And you can support all of that with simple, accessible movements all day long. And there's a couple of really fantastic hygienists that are out there just speaking this language all the time because they do some really great things to help hygienists kind of put this at the center of their mindset when they're treating patients. And they do things like teaching you how to do cat-cow stretches in the morning, or gentle core activation exercises, or resistance band rows and wrist circles, right? Wrist circles and forearm stretches and hip openers like figure four stretches. And guys, you don't really need to be perfect at like I've done some of these yoga classes at RDH under one roof with the aligned hygienist. She's amazing. But I got to tell you, you guys kind of put this on the back burner. Your most important clinical instrument is your body. And as you get older, you will thank your younger self for doing all these little things that I'm talking about here. So here's some of the things that students don't hear enough. Okay. You deserve to feel good in your body while you are learning. Oftentimes, you guys think the headaches are from stress. right? You are not weak for feeling discomfort. You are not behind if the ergonomics feel awkward. You are not overreacting if your back hurts after clinic. You are learning in a profession that requires precision, that requires a lot of patience, but also requires a lot of physical awareness. And you are allowed to take care of yourself while you do it. Your body is not an afterthought. It is part of your professional identity. These are so important to really think about these types of things. And I had to learn myself all of the things that was required for me to keep myself healthy, to keep myself out of pain, and to keep myself showing up at 100% for all the patients that I work with. And I have discovered that consistency with the small, meaningful movements is where it's at, guys. Those are the things that really move the needle so that you can actually maintain these types of things. So as you go into your next clinic session, I want you to carry this with you. Every single adjustment that you make is an act of kindness to yourself. Every time you reposition the patient, every time you reset your shoulders, every time you stretch, you're investing in your future career. Now, if you guys want more support, I have resources that go deeper into ergonomics, posture, and building healthy habits as a student. You can find some of these components in my companion workbook and in my Starting Strong podcast series. Both are designed to help you feel confident, prepared, and supported from day one. You guys are doing incredible work. Your body deserves the care along the way. And as you know, I'm cheering for you every step of your journey. It's been really great hanging out with you guys. I'll see you next week.